Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going to talk about Jeff Bezos, the founder of Amazon. We're talking about him because somewhat recently, before his trip into space and his rocket Blue Origin, there were some photos taken of him, and his entire face looked like it had been inflated. He looked extremely poofy. His lips were plumped up. His cheeks were plumped up. It looked like sort of like somebody had facetuned an entire face to make it look like it just blew up. After that, some people were calling him Juvederm Jeff. So suspicious that maybe there's some fillers in his face. And like I always say, it's probably better to look your age than strange. And in this case, he started looking strange and poofy, and so everybody took notice of it, and everybody started commenting on it. So we're going to take a look at his face and say what we think happened and maybe how to avoid doing that to your face. So why are people so obsessed with Jeff Bezos' face right now? The answer is it's such a drastic change. So if he'd been more gradual, they probably wouldn't have taken notice of everything. And then secondly, in his case, and with a lot of successful men, women too, people that are in the limelight a lot, they don't have a lot of time for downtime. So it could be possible that he went in and got a procedure done, and he didn't wait long enough to go and have, get into front of the cameras. Or secondly, he got bad advice. Maybe when he went in, they said, oh, don't worry, you're not gonna be swollen, everything's gonna be fine. He went and got something done, he poofed up, and then he had no choice because he had everything scheduled to go. So those are some things that can happen when people look really poofy. They could have maybe come out too early, or somebody overdid it. In accordance with that, I would say if we look at some photos of him more recently or a little bit after that time, he doesn't look quite as poofy. So again, it could be something that was swelling, or maybe he let some of the fillers subside and come down. But we know when we look at him a little bit time after that, he doesn't quite look as poofy. And the other thing I want to say about that in his case, if it was fillers, is people underestimate the swelling that can happen with those fillers, and if he did a large volume. And some of the reasons with the fillers in particular is that they like to attract water. So they're called hydrophilic, so when you inject them, they can attract the water and you can look poofy and swollen. And so in his case, if he put a large amount in, he could have looked really poofy and swollen. So some advice I would have told him in the future is if you want to avoid some of that, fat grafting may be a better option for him because it doesn't attract water, it doesn't look poofy. It's much more natural, it lasts longer. It's also living tissue, so it's going to continue to rejuvenate his face from the inside out rather than just dissolving and going away. Now, it doesn't mean, again, you want your face that poofy, so you do a more conservative amount. I did a little morphing of his face to show you what I would think would look better, just a little bit of small amount of conservative fat grafting, and then possibly maybe a little bit of an eyelid surgery or something to balance out his eyes and also make him look more rested and a younger version of himself rather than a poofy, strange version of himself. I think one thing to say about Jeff possibly or allegedly getting fillers in his face is that we are seeing more and more men stepping out and doing cosmetic work. So good for him for taking the risk. I would say it doesn't need to be a risk. I think if you had gone more conservative and just gradually increased things, it would have been better for him. And then I think it's also interesting because we've kind of moved past the stigmata of plastic surgery and cosmetic surgery and fillers and Botox, where in the past it used to be shunned or very secretive or didn't want anybody to know. Now it's more widely accepted, and it's almost for some people a status symbol. Some people are doing fillers and posting about it and wanting attention from it, rather than the past when they didn't want anybody to know they did anything. So that's kind of a little interesting change in the turn in the tide, I think, in the world of cosmetic surgery, for better or for worse. It's definitely more accepted, and I think the positive note of that is that people are getting more educated, they're getting more information, they're knowing what things can do, and then we're trying to educate on how to avoid looking strange or overdone. So I think all those things hopefully are getting people more educated about the world of cosmetic surgery and plastic surgery. I kind of made this point previously, but one other thing I wanted to say again is that no matter how much a procedure is advertised as minimally invasive, rapid recovery, you have to account for downtime. And in Jeff's case, again, maybe he just got out too early in front of those cameras and he was swelly and poofy. And the other thing I get a lot of, because I was involved in reality shows, is when do you see those patients? When are they on the show? Is it a week after they had their surgery, a month after they had their surgery? In most cases, we did that many months after their surgery. People's photos online, they're not right after the surgery. It takes sometimes months for all the swelling to come down. Now, in regards to fillers and Botox, much less. But again, even when a minimally invasive injections in the face can come with swelling and bruising. And so patients should allow for that downtime. If they have a big event coming up, if they're going to be in public, if they're going to be seeing friends and family, know that even a minor procedure can come with that swelling so that they can account for it and not have to go to the event looking strange. I also think in regards to like Botox, patients don't realize you get the Botox and it's going to immediately freeze you in that moment, and that's not true either. It takes about a full week to take full effect. And then in that case, if they were aggressive with it, it can overly freeze you for a minute, and then it needs to kind of calm down and adjust. So again, you don't want to rush into that. You want to plan that out so that if you are doing something for a big event or photo shoots are going to be in front of millions of people, plan for that little bit of downtime so you have a little bit of cushion there so you don't end up going out being a little bit too frozen or too poofy. And as that calms down, you look amazing and great. So you can avoid having that exposure that you may have done something. And then lastly, another reason I tell patients to go conservatively with anything, but also with fillers and Botox, you can always do more. So it's much better to go in, do a little conservative amount, and then see how it settles in. And then if you want a little bit more, go do a little bit more. Do a little touch-up. Do it gradually so that you don't go and get overdone and it's really noticeable and it's poofy. And then secondly, with the Botox, if you overdo it and get frozen, you're going to have to wait it out. You're going to have to wait that 4 to 6 months for everything to wear off, rather than going in, doing a little bit, doing a little bit, doing a little bit. So I advise patients to try that, particularly in the beginning if they're just starting with the fillers and Botox. And then secondly, with the fillers, don't go in and put tons of syringes of fillers in your face. Go in and do a little bit. Because although they say you can dissolve the fillers, when you go in and you got to dissolve the fillers, the enzyme that dissolves that filler can cause swelling. So then you're going to be even more swollen. And then secondly, those enzymes that we're injecting, called hyaluronidase, it can affect the integrity of your own tissue, your natural tissue. So you don't want to be going up and down and poofy and not poofy and swelling and putting all these things in your face if you don't have to. So again, I would advise everybody start gradually and go incrementally. See how you like a little bit, do a little bit more. So again, I get this question a lot, but people say, Jeff Bezos is one of the richest men in the entire world. How does he get bad filler in his face, allegedly? And the answer is, we don't know for sure, but it is interesting that no matter how rich people are or powerful or wealthy, they can still get bad filler or bad plastic surgery. And I think that has a little bit to do with, like I've said before, that the plastic surgery, cosmetic surgery marketplace is very confusing. There's a lot of false advertising and craziness out there. And they get duped just like the rest of us. And they're even more targets because they have expendable money. They have the funds to pay for plastic surgery and fillers. And then secondly, I think that some of the more famous wealthy people won't like to go into a doctor's office. They'll want in-home injections. They'll want to hide. They don't want people to know what they're doing. So they'll rely on word of mouth or publicists to recommend somebody. And a lot of times I've seen this in those circles of celebrities and very famous people, that they keep it within that group of people. And sometimes a publicist is being rewarded for referring patients to them. And I'm not saying they didn't have his best interests at heart or their best interests at heart, but they've limited their access to a wide range of very experienced professionals by kind of staying in that close-knit group. And I'm not saying that's what happened to him, but I have seen that a lot. And then secondly, a lot of people ask me, well, these are very powerful men. These are very wealthy men, famous celebrities. Why don't they sue these injectors? Why doesn't something happen if they get bad plastic surgery or bad work? And the answer is, once you file a lawsuit, it's public knowledge. And that's kind of what they were trying to avoid in the first place. So they kind of get trapped behind the scenes with these poofy faces and things because they don't really have much recourse. They went to do it in secret in the first place, and now they don't want to reveal their secret by filing a lawsuit. I assume what Jeff was trying to go for maybe was sort of a younger, more distinguished, a more attractive version of himself. Somebody had said that kind of like a George Clooney's edgier brother sort of a thing, and he wanted to be kind of this leading man and look more vital and, like I said, more attractive. The problem is that would entail trying to put kind of George Clooney's architecture on Jeff Bezos' face, and that doesn't always work. It's kind of like trying to put a square peg into a round hole. You have to work with the anatomy you have in front of you. And I think that when you try to do these extreme things, that's when people look strange. So instead of trying to go strange and look like something different, if you try to just look like a younger, better version of himself, I think maybe that's what he was going for, but didn't turn out that way because it went too extreme. So I think that when you're seeking out plastic surgery, again, same sort of rules. Try to have a doctor that's going to work with anatomy that's in front of them, and that we're going to go conservative and we're going to do things that are going to make you look like a better, younger version of yourself. And that way you can avoid looking like a caricature of yourself and strange and poofy. Just remember all that when you go in, and try to listen to the advice of your doctor, because they hopefully have your best interests at heart. So So I think a takeaway from the Jeff Bezos story is that plastic surgery and cosmetic surgery is very common now. And fillers and Botox and things like that, when done correctly, are very effective and very safe. And then, like I said, working in the realm of celebrities and people that have to be in front of cameras and different sorts of media, doing things in a staged manner, doing it gradually, slowly building up things and testing out different sorts of fillers and Botox. And that way, I think you can avoid looking strange. And I also think that the time of the extreme makeovers, it should be going away a little bit. Most patients don't want the extreme makeover. They don't want to look like somebody completely different. They want to come out of the office looking like themselves, maybe refreshed, like they took a nice long nap. They're looking younger, rested, prettier, more attractive. So again, if you do it in that stage sort of approach, I think that you have a much better chance of getting the results you want. So I want to make sure people don't think I'm picking on Jeff Bezos, but I do want to say that in general, sometimes powerful, wealthy men can be stubborn. And so I think there isn't a lot of empathy and sympathy for Jeff Bezos because the public interpretation is kind of like he's this Lex Luthor, sort of Dr. Evil, sort of wealthy billionaire Amazon businessman. So they can maybe see how maybe he wouldn't listen to the advice of his doctor. And this is what can happen sometimes if patients don't listen and they think they know better than their doctor. Maybe he talked them into it. And then secondly, probably bad on the doctor that did this work, or injector if it's not even a doctor. Who knows who did it, allegedly. But the first rule is do no harm, and that doctor should have said, no, maybe this is going to be too much for you. We need to start more gradually. The problem we see is that in that case, some doctors will say no. They'll say, don't, this is going to be too much for you. You're going to be in the camera, do something gradual. But they'll maybe find a less scrupulous doctor out there who is more interested in Jeff Bezos' money, and he'll do it. And he'll poof up his face, and then Jeff will say, oh my God, this is way too much. Now, the good news is, because it is most likely filler, it is reversible. So over time, like we've seen in his photos, it will come down, and it's not permanent. Thank God it wasn't some big type of surgery. And I think hopefully Jeff learned his lesson, and he will be more conservative in the future, whether it's back here on Earth or in space. Learn your lesson and be more conservative if you're going to go and do any fillers or plastic surgery.
Jeff has so much money, and he's clearly interested in aesthetic enhancements. So a hair transplant seems like it would have been the obvious choice for him because the result is so much more natural than facial fillers. Do you think...
Well, it can all be natural, but right.
Do you think that he didn't have enough hair to harvest from, or why do you think he didn't go that route? I edited some pics of him with hair. He looks way hotter.
Yeah, well, I think it could be one thing that comes immediately to my mind is when men have gone completely bald or shaved their heads and they do a hair transplant, very noticeable, right? If he was more like Elon Musk, we may talk about, and it's starting to thin, it's a little less noticeable if they do it then. Now, if they wait till they're completely bald and then they put the hair on, people are like, whoa, something happened here. So it's a little bit harder to hide it.
It's like John Travolta when he puts on his wigs.
Right.
Yeah.
So, and then secondly, you may be right. I mean, at some point, if there's a huge amount of hair loss, how much donor is left? What are we doing there? And there is a way that, similarly with that hair graft, if he had enough donor, he could do it a little more gradually, maybe, But since he shaves his head completely, and then all of a sudden you're having hair, I think it would be really noticeable, kind of like when you overdid the fillers. So that's a tough spot. But some people have done it. I know people like Brian Urlacher from the Chicago Bears. It's big in Chicago, the hair replacements, and he was totally bald, and he came back with a full head of hair. So it was a little shocking. But so I think in his case, same thing. He's so more well-known in all over the media that if he all of a sudden showed up with a full head of hair, people would take notice and go, you didn't have that last week. Where did that come from?
My last question is not intended to be mean, but Jeff has a lazy eye. Would that be corrected with a blepharoplasty, or how do you correct a lazy eye?
Yeah, so-called lazy eye is usually not something that's corrected with just simple cosmetic surgery because it can be due to a few different things, but sometimes it's different vision in the eyes or being able to focus in both eyes, or secondly, muscle imbalance in the eyes, so, or both. So it's not something, it has to do with the way that the eyes are able to focus and move around, and there's no way to correct that with a simple blepharoplasty or cosmetic surgery.